So, one of the important questions that I'm often asked is, are these diseases very common? Are these diseases rare? Or should we really talk about these diseases? Now, to give you a perspective, let me tell you that this is not a single disease. The group of diseases that I'm talking about is not a single disease, it's a collection of diseases. And the latest classification that was proposed last year said that there are close to 485 diseases under this umbrella. Now, let me tell you, as I speak, the number keeps expanding, and I will not be surprised that today the number has crossed 500. What do I mean by this? Well, way back, say if you go 2 decades ago, 20 years back, there were only 50 diseases that were described under this umbrella of primary immune deficiency. 5 years back, this number crossed 200, and now this number has almost touched 500. Now, why is this happening? This is because of rapid advances in medical science and molecular genetics that new genetic diseases are being discovered. And that is why newer diseases are being described, and patients who did not have an appropriate diagnosis, say 10 years ago, today are being diagnosed because of better availability of diagnostic facilities. Well, what does it mean to the population out there? How common is it in the population? These diseases as a group are very, very common, and 1 in 1,000 individuals are said to be affected with one or the other primary immune deficiency. 1 in 1,000 is not a small number. What does it mean to our country? It simply means that more than 1 million people are affected in India. That's a huge number. But what is the actual number that is being diagnosed? At the moment, as I speak, a few hundred patients or a couple of thousand patients must have been diagnosed to have immune deficiency. It simply means that several thousands of patients are not being diagnosed, and they keep suffering for months and years. And some of these diseases are so severe that these children die at a very young age without getting diagnosed. And that is why there is an urgent need to raise awareness regarding these diseases in the society.